back to another episode of News for You. We are your hosts, Jack,
Cami, and Samora.
And today our main focus will be on abortion, a very controversial topic within the United States.
For some background, abortion is a medical procedure provided to pregnant women to remove the fetus if they no longer want to continue the pregnancy.
This topic is highly controversial due to religious, political, and economic aspects. Many bills have been placed to prohibit women from accessing this medical procedure. Let's travel back.
Back in 1970, Jane Roe, or Norma McCovey, gets pregnant for a third time and decides she does not want the baby. At the time in Texas, abortion was only legal in the case that the mother was actively being harmed by the pregnancy. McCorvey's goal was to get a quick grant for an abortion, but instead her lawyers picked her to represent the harm of the current abortion restrictions to create a whole new law.
After creating a whole new law, Texas appealed and the Supreme Court ruled that during the first trimester of pregnancy, a pregnant woman now had the right to have an abortion, regardless of what the state they lived in believed. Abortion was now a constitutional right.
Now let's come back to the present. Just last year, Roe v. Wade was overturned, meaning that abortion was no longer deemed a constitutional right. Since it was no longer a federal right, it is now up to each state to create laws governing abortion.
Traditionally, there are two sides to this topic, those who are pro-choice and those who are pro-life.
Here's a video of a Republican congresswoman reacting to a pro-choice protest.
Shame on you! Shame on you! Shame on all of you! Shame on you killing babies! You're a murderer! You're a murderer! You're a murderer! You're a murderer! Shame on you! I'm a murderer! I murdered my own baby! Shame on you! Shame on you! Shame on all of you!
Video of Addison Gardner, who is a 12-year-old girl, speaking about West Virginia's new abortion law.
I'm 12 years old. I attend Buffalo Middle School, I play for varsity volleyball, and I run track. My education is very important to me, and I plan on doing great things in life. If a man decides that I'm an object and does unspeakable and tragic things to me, am I a child supposed to carry and birth another child? Am I to put my body through the physical trauma of pregnancy? Am I to suffer the mental implications? A child who had no say in what was being done with my body. Some here say they are pro-life. What about my life? And does my life not matter to you?
Here we have a pro-choice advocate. So, what are your views on abortion?
Thank you so much for having me. I think it's really important to recognize that advocating for a woman's right to choose doesn't necessarily mean promoting abortion. It's about respecting an individual's autonomy and ensuring access to safe and legal reproductive health care options.
Okay, so now we have a pro-life advocate. So, what are your views on abortion?
From the pro-life perspective, the emphasis is on protecting the sanctity of life from contraception. It's rooted in the belief that every unborn child has a right to life, and we should work towards providing alternatives and support for women with unplanned pregnancies.
It was great to hear from both sides. Thank you guys for sharing. Now, before we continue, let's touch on the legal aspect of abortion. Abortion rights and laws vary widely around the world. In some places, women have the right to choose, while in others, restrictive laws may limit access. Understanding these legal frameworks is crucial in comprehending the challenges women face. Laws vary from state to state. Let's travel to a hospital in California.
Hello. Hi, how are you? I'm good. Can I get an abortion, please?
Yeah, what's your name and your age?
Lana, I'm 18.
Okay, how many weeks are you?
15 weeks.
15 weeks? Okay, you have up to 24 weeks to take this procedure, so your baby's viable.
Perfect.
Now, let's take a trip to a hospital in Alabama.
Hi, how can I help you today?
Can I get an abortion, please?
No, I unfortunately can't. I'm sorry. In the state of Alabama, it's not allowed.
But I don't want it.
Here's some adoption pamphlets I can give you. Have a nice one.
10-second trivia. How many teens aged 15 to 19 on average in the U.S. get pregnant?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
The answer was 14 out of 1,000.
Now let's take a moment to understand the difficulties that teenage women may face when carrying out a pregnancy.
One of the significant challenges mothers have is the potential disruption to their education. Balancing parenting responsibilities and pursuing an education can be very difficult for them.
Many teen moms find it difficult to stay in school. This leads to lower academic success and less career opportunities. This academic disruption has long-term consequences. Now let's talk about the economic and social strain on teen mothers. Cami, can you take this one?
Certainly, teenagers generally have fewer financial resources, and raising a child involves significant costs. Financial strain can affect both the well-being of the teen mother and the child. This strain may exacerbate other challenges they face.
With all the negative consequences, an individual should be allowed to have an abortion if they wish.
Enter the Ensuring Women's Right to Reproductive Freedom Act. This bill prohibits anyone acting under state law from interfering with a person's ability to access out-of-state abortion services. Abortion services include the use of drugs that are approved to terminate pregnancies and any healthcare services related to an abortion, whether or not the services are provided at the same time or on the same day as the abortion. Specifically, the bill prohibits any person acting under state law from preventing, restricting, impeding, or retailing against healthcare providers who provide legal services to out-of-state residents, any person or entity who helps healthcare providers to provide such services, any person who travels to another state to obtain such services, any person or entity who helps another person travel to another state to obtain such services, or the movement in interstate commerce of drugs that are approved to terminate pregnancies. The Department of Justice may enforce this bill through civil actions. The bill also establishes a private right of actions for violations.
Bill 929 is the Abortion is Healthcare Everywhere Act. This act would amend the Foreign Assistance Act to repeal the Helms Amendment, which basically has been used to ban foreign assistance from funding abortion services under any circumstances. It also replaces the Health Care Everywhere Act with language explicitly stating that U.S. foreign assistance funds can be used to provide comprehensive reproductive health care, including abortion. It's the first bill of its kind in nearly 50 years the Helms Amendment has existed.
Do you think everyone has the same opportunity to get an abortion no matter how much money they have?
I think not everyone has access to a safe abortion. I think money's an issue because obviously those who are living like minority communities or have a lower socioeconomic status might not have like the ability to go to a safe place to get an abortion if they need it or want it. So I think there is like an inequality with money and access to a safe abortion. Obviously, we like heard of scenarios where people have had abortions that are not safe and people die from that. So I definitely think money is a limiting factor in getting safe abortions.
Can you provide an overview of the different types of abortion procedures available?
Sure. There are medical abortions and there are surgical abortions. Medical abortions involve taking 1 or 2 pills, usually 2 pills. The first, mifepristone, is a pill that works sort of against the body's normal hormones, so it's called an anti-progesterone. And the second is misoprostol, and that just kind of helps the uterus sort of cramp and get everything out. Those are relatively easy to use. One of them is known commercially as RU486. You've probably heard that term before. And typically they cause a lot of bleeding and cramping initially, and then spotting over the next couple of weeks. There are also a few types of surgical abortions. There's a suction technique where gentle suction is used to just kind of clean out everything in the uterus, and that can be used a little bit earlier on. And then for later pregnancies, there's a dilatation and evacuation technique where they kind of dilate the cervix up a little bit, often using some medications, and then they use forceps, which are sort of like large tongs, to pull everything out and then suction out the other material and then kind of scrape off some of the lining of the uterus.
Okay, and how does the gestational age of the pregnancy influence the choice of abortion method?
Typically, the medical abortions are used under 12 weeks. Very occasionally, people will try them above 12 weeks, but certainly under 12 weeks, that's a reasonable option. I do think it's important to recognize that although it's very rare, there is a small failure rate for medical abortions. So it's super important for people to have follow-up and make sure that it worked effectively. And then for the surgical abortions, the suction technique can be used up to about 16 weeks, and the evacuation technique can be used up to about 24 weeks.
What safety precautions do you guys take surrounding abortion procedures?
Well, I think most of the abortion procedures done in a medical facility in a state where abortion is legal tend to be relatively safe procedures. So I think a lot of the safety issues really come before the decision is made and after the procedure is done. So certainly there are some reasons why a certain abortion technique might not be appropriate for a certain woman. So one thing is, where is the pregnancy? Now normally a pregnancy implants in a safe part of the uterus, and this is for a normal pregnancy, whether or not you're having an abortion. But occasionally people will have what's called an ectopic pregnancy, where the embryo implants in the ovary, the fallopian tube, or like the cervix, someplace where it would be really unsafe for a pregnancy to continue. And those pregnancies have to be terminated, whether an abortion is desired or not. And the techniques used there are a little bit different. And so establishing that it is just kind of a normal pregnancy in the normal place before an abortion is performed in the standard fashion is really important. And then also just knowing a little bit about the woman's medical history. Does she have a reason to bleed too much? Does she have a reason to clot too much? And making sure that whether a medical or a surgical abortion is decided upon, it's done sort of in deference to any underlying medical problems that she would have. And then in terms of after an abortion, some people will have bleeding, some people will have a lot of pain. People can get blood clots. It's not common, but it can happen. And like I said, very occasionally there's a failure rate where everything is done appropriately and for whatever reason it doesn't work. Also, people can have pain, they can have nausea, infections can occur. These are all very rare complications, but I do think it's really important for people to have a follow-up plan. If you do come from a state where it's not legal, you just can't go back immediately. You have to stay in a place where you can get follow-up care, at least for the next week or so, if you need it, where you feel really comfortable disclosing what happened and what the history was so that you can get the appropriate care that you need.
And how are minors seeking an abortion protected?
You know, it is a state-by-state question, and so every state has their own rules, and it's really important if you're in another state to kind of look into what is permitted in that state. In California, anyone can seek care for sexual and pregnancy-related issues above the age of 12 years with confidentiality. So you are permitted, if you're above 12 in California, to request an abortion, undergo an abortion without permission from your parents, and also without that being disclosed to your parents.
Okay, thank you.
Our first solution is to make sex education within schools a required taught subject. It is important for students to know the risk of pregnancy and ways to prevent it. A course on contraceptives would be the most educational. In addition to this, contraceptives should be more accessible.
Our next solution is to make abortion available within clinics across the U.S. for anyone over the age of 15. The fetus must be less than 24 weeks along, and the patient must be taught all of the risks beforehand and continue to consent to the procedure. In addition, at-home pills should be available in pharmacies across the U.S. as long as the individual is again aware of the risks.
Finally, our last solution is to allow the adoption system to be more attainable to families. If teen moms knew their baby had a high chance of being adopted and safe in a loving family, they would improve the chances of them carrying out the pregnancy. Also, improving the qualifications of being a foster parent should be acted upon. Many children are in abusive households that do not get the resources or funding they need and don't have safe environments. Improving all of these factors will allow for teen parents to consider carrying out their pregnancy.